Diabetes mellitus is a deadly condition which affects many Nigerians. About 4 to 5 million Nigerians are affected with this condition. Diabetes mellitus affects about 400 million people worldwide. Diabetes is described as a condition whereby blood sugar is persistently elevated. This persistent elevation of blood sugar is due to abnormalities in the way that we handle our nutrients, which include carbohydrates, protein, and fat. People that have diabetes, the blood sugars become abnormally high and persistently high because the body is either not producing sufficient amounts of the hormone called insulin. This hormone or chemical is produced by the body to regulate the amount of sugar or glucose that is present in our blood. In diabetes, the amount of insulin produced is either inadequate or the body is poorly responsive to the amount of glucose produced. When a person has diabetes, one of the common symptoms will be passage of plenty of urine, excessive thirst, weakness, blurring of vision may occur. Quite a number of the patients may lose weight. Some of them may have peppery sensations in the feet or itching all over the body. Some patients might notice an increased risk of boils, so they will have frequent boils, maybe in the armpits, in the groin, or in different places. But in quite a large number of people that have diabetes, the condition does not give any symptom at all, which means that the person may think he or she is healthy, going about their normal daily routine with the diabetes continuing undetected. For this reason, diabetes is often regarded as a silent killer. Diabetes usually reduces the quality of life, and also it reduces the lifespan. And this is because diabetes leads to various conditions such as strokes, heart attacks, heart failure, kidney failure, blindness, erectile dysfunction, and then also gangrene or decay of the lower limbs, which leads to amputations of the lower limbs. Diabetes is also known to predispose those who suffer from it from frequent skin infections, recurrent miscarriages, and several other medical challenges. How is diabetes diagnosed? The diagnosis of diabetes can easily be made, usually by a blood sugar check. And all the person needs to do is go to a nearby laboratory and have his blood sugar checked. If your blood sugar in the fasting state, meaning when you have not eaten, exceeds 126 milligrams or 7.1 millimoles, then that person is likely to have diabetes, especially if you repeat that test a few days later and it still remains that high. Diabetes is treatable, and the treatment consists of a healthy choice of diet, regular exercise, cessation of smoking and excessive consumption of alcohol, and usually in most patients, the prescription of some medications which might be taken orally or might be taken in injectable form. Diabetes requires lifelong treatment. For patients who are properly treated, diabetes need not reduce the lifespan, and it need not reduce the quality of life. For people who are not sure whether they do have diabetes, it is good to go to a nearby laboratory to check your blood, especially if somebody in your family has diabetes, especially if you have hypertension, and also if you notice changes in your vision, or the person has had miscarriages or poor erection. These are usually evidence that diabetes might be present. When you have diabetes, regular checking of your blood sugars, monitoring of your blood pressure, keeping to the diet, keeping to other lifestyle instructions will lead to a normal, healthy life. Patients who do not know they have diabetes, patients who have diabetes and do not care for it properly, are at risk of premature death. It is my desire that you will not be a victim to diabetes or its complications, but that you, if you have diabetes, will manage it properly. And if you don't have diabetes, that you will do everything so that you will not have it. Wish you good health. God bless you.